I've always considered myself a dedicated healthcare professional. For the past 7 years, I've worked as a clinical research coordinator at Medinova Therapeutics, a mid-sized pharmaceutical company specializing in developing treatments for autoimmune disorders. My role involves managing complex drug trials, coordinating with patients and physicians, maintaining meticulous documentation, and ensuring strict adherence to research protocols and ethical guidelines. When you're handling experimental treatments that could impact patients' lives, integrity isn't just a corporate value, it's a moral imperative. I was diagnosed with fibromyalgia 4 years ago after months of unexplained pain, fatigue, and cognitive difficulties. The diagnosis explained the mysterious symptoms that had been affecting both my personal and professional life, the constant pain that made long hours at my desk excruciating, the fatigue that sometimes made focusing on detailed protocol documentation feel impossible, and the periodic brain fog that complicated my interactions with research participants. After my diagnosis, I disclosed my condition to HR and my supervisor, Dr. Patel, who worked with me to implement reasonable accommodations. I now use an ergonomic workstation, take scheduled short breaks to stretch and move, and occasionally work from home during severe flare-ups. Our clinical research department consists of 14 coordinators, each assigned to different drug trials in various stages of development. While we collaborate on department-wide initiatives, we generally manage our own trial portfolios independently. Success in our field depends on scientific rigor, careful documentation, regulatory compliance, and maintaining the trust of patients who volunteer for our studies. Our company culture emphasizes scientific integrity and patient safety above all, principles emblazoned on the walls of our research facility and reinforced in every quarterly meeting. That's why Marcus Wilson stood out from day one when he joined our team 10 months ago. Marcus was hired as a senior research coordinator with impressive credentials, a master's degree in clinical research administration from a top university, 6 years at a prestigious research hospital, and references that painted him as a rising star in the field. He was articulate, confident, and quickly became a favorite among the leadership team. Our department director, Dr. Rivera, was particularly impressed with his previous experience managing Phase 3 trials and the innovative recruitment strategies he proposed. But something about Marcus never sat right with me. Perhaps it was my experience with fibromyalgia making me more attuned to insincerity. When you live with an invisible illness, you develop a sixth sense for detecting when people aren't being genuine. I noticed subtle inconsistencies in his behavior. He would appropriate ideas proposed by junior coordinators in team meetings. He'd promise collaboration, then mysteriously become unavailable when actual work began. He'd take credit for successful patient outcomes while deflecting responsibility for protocol deviations. I tried giving him the benefit of the doubt. Starting at a new research facility is challenging, and perhaps he was just trying to establish his reputation. I even invited him to join me for coffee during his second week, hoping to foster a collegial relationship. During our conversation, he made a casual remark that should have been a red flag, that research documentation is subjective, and with the right presentation, you can make the data tell whatever story the company wants to hear. I awkwardly changed the subject, assuming he was making a cynical joke. He wasn't. As months passed, Marcus became increasingly established at Medinova. He was assigned to lead our most promising clinical trial, an experimental treatment for rheumatoid arthritis that represented over 40% of our company's research investment. This trial involved coordinating multiple research sites, managing hundreds of participants, and preparing critical documentation for eventual FDA submission. It was high-visibility work with direct oversight from the executive team. Meanwhile, I continued managing my 3 smaller trials, carefully maintaining research protocols and putting in extra hours to accommodate my fluctuating fibromyalgia symptoms. I had developed strong relationships with my research participants and site physicians through consistent communication and unwavering commitment to scientific integrity, even when preliminary results didn't match our hopes. The tension between Marcus and me developed gradually. It began with him asking me to review his protocol documentation without acknowledging my input in team meetings. Then came requests to quickly check his adverse event reports, which often revealed alarming errors that could have compromised patient safety and regulatory compliance. Each time I identified these issues, he'd express private gratitude, but never mention my contributions to management. I might have continued indefinitely in this uneasy but tolerable dynamic if not for what happened during our quarterly data review period. The incident that would ultimately lead to Marcus's downfall, and forced me to take a stand for patient safety and research integrity. It was mid-October, and our department was consumed with quarterly data analysis and reporting. I had stayed late 3 evenings in a row to finalize my trial documentation, meticulously cross-checking participant data and adverse event reports. My fibromyalgia made extended work sessions painful, but the quiet evening hours without interruptions were essential for completing the detailed work with the focus it required. On Thursday evening, I thought I was alone in the office until approximately 9:15 p.m. when I finished my last report and decided to stretch my legs before heading home. As I walked past the data management room, I noticed the lights were on and Marcus's bag was on a chair. The door was partially open, so I glanced in to say goodnight. What I saw stopped me cold. My trial documentation was open on his computer screen. Not just open, but actively being modified. Marcus had accessed our secure research database and was copying data from my rheumatoid arthritis pilot study, one of my smaller trials that had shown promising early results. Next to it was a document labeled Wilson_primary_analysis_Q3.pdf that contained my exact data tables, but with different participant identification numbers. I stood motionless in the doorway, my brain struggling to process what I was seeing. Marcus was falsifying research data. But why? He had his own trials with larger patient populations and more institutional support. The answer became clear when I noticed another open file. An email from Dr. Rivera expressing serious concerns about the inconsistent efficacy results in Marcus's main trial and requesting a comprehensive explanation by tomorrow's executive committee meeting. Marcus had encountered problems with his trial results and decided to incorporate my more successful data into his reports. I must have made a sound, because suddenly Marcus turned around. His expression cycled through surprise, alarm, and then settled into forced casualness. He offered a surprised greeting, pretending to be caught off guard by another person working late. When I directly questioned why he was accessing my trial files, he claimed Dr. Rivera had asked him to review everyone's methodology for the upcoming FDA inspection. It was an obvious lie. Research coordinators are never authorized to modify another coordinator's data without formal documentation and approval. Besides, if this were an official review, why was he creating a document that merged my data with his trial identifiers? I confronted him about falsifying research data for his own trial reports. His friendly demeanor instantly vanished. He moved toward me, speaking in hushed tones despite the empty office. He attempted to minimize the situation, claiming he was merely using my data structure as a template because our patient populations were similar. When I called it what it was, data falsification and a serious research ethics violation, he laughed dismissively. His response was stunning. He suggested everyone makes adjustments to data presentations sometimes, and that no one would ever know because trial results aren't compared against each other once they're submitted to regulatory authorities. He added that management only cares about positive outcomes that attract investor funding. My face flushed with both anger and pain as my stress triggered a fibromyalgia flare. This wasn't merely about professional dishonesty. This was potentially dangerous. Falsified clinical trial data could lead to ineffective or unsafe treatments reaching patients. When I threatened to contact Dr. Rivera immediately if he didn't close my files, his expression turned calculating. He reminded me of his status, barely 10 months with the company, yet already leading our flagship trial, with the full confidence of the executive team. Then came the truly unforgivable blow. He weaponized my fibromyalgia against me. He explicitly questioned who management would believe, him, with his flawless research record and prestigious background, or me, the coordinator who frequently requested accommodations for an invisible condition that many people don't even consider real. I couldn't believe he would use my medical condition, something I disclosed in confidence, as leverage against me. My hands began trembling, partly from anger, but also from the adrenaline surge that was intensifying my pain. For a moment, doubt crept in. Would people believe me? Would they dismiss my concerns as confusion from fibro fog or attention-seeking behavior? Then I remembered something critical. I had evidence. Marcus's computer screen clearly displayed both my original data and his falsified document. While he continued justifying his actions, I discreetly positioned my phone and captured several photos of his screen. Marcus noticed the camera shutter sound and lunged toward me, demanding I delete the photos immediately. I stepped back. keeping my phone out of his reach while insisting what he was doing was wrong, not just professionally unethical, but potentially harmful to patients who might eventually receive treatments based on falsified efficacy data. With his professional mask completely gone, he threatened that I had no idea what I was getting involved in. He'd worked too hard to reach his position to let someone with a questionable medical condition ruin his career. Just then, Dr. Chen from Biostatistics appeared in the hallway. She had apparently returned to retrieve some files and heard raised voices. She found Marcus standing aggressively close to me, my back against the wall, both of us clearly in a heated confrontation. Dr. Chen inquired if everything was all right, looking concerned. Marcus immediately reverted to his charming persona, claiming we were just having a spirited debate about data normalization methods. Dr. Chen seemed skeptical but didn't press further. After retrieving something from her office, she left. As soon as she was gone, Marcus issued an unmistakable threat. He insisted I delete the photos and forget what I'd seen, warning he would make my professional life unbearable if I didn't comply. He pointedly reminded me who had more credibility with the research team and implied my career advancement would be permanently compromised if I challenged him. Despite my racing heart and increasing physical pain, I stated firmly that I would report his data falsification. His face contorted with anger as he called me naive and foolish. Without another word, he closed the files, grabbed his bag, and stormed out, brushing roughly past me in a way that sent a jolt of pain through my hypersensitive nerves. I remained alone in the data room, my entire body now throbbing with pain from the stress-induced flare-up. I questioned whether I had just derailed my career but knew I couldn't remain silent. This wasn't just about Marcus stealing my work. It was about research integrity, regulatory compliance, and ultimately, patient safety. The next morning would bring the confrontation that would change everything. I barely slept that night. The combination of physical pain from my fibromyalgia flare and anxiety about the impending confrontation kept me awake. My mind cycled through scenarios of how reporting Marcus might backfire. Would management believe me? Would my condition be used to discredit me, painting me as confused or unreliable? By morning, my anxiety had peaked, but my determination remained unshaken. I arrived at the office an hour early, hoping to speak with Dr. Rivera before the day's scheduled meetings. To my surprise, Marcus was already there, looking haggard with dark circles under his eyes. He glanced up as I entered, his expression a mixture of exhaustion and defiance. He informed me curtly that Dr. Rivera was in an early conference call. I nodded without responding and headed to my desk, feeling his gaze following me. As I logged into my computer, I received an email from Marcus, sent at 3:42 a.m. It proposed we meet with Dr. Rivera together to discuss the collaborative methodology review we'd been conducting. He suggested presenting a united analysis that incorporated insights from both our trials, promising to ensure I received appropriate acknowledgement for my valuable contributions to improving the data quality of the main study. The email was cleverly constructed, creating a paper trail that reframed his data falsification as legitimate scientific collaboration. I didn't respond. Instead, I prepared for my meeting with Dr. Rivera by organizing my evidence, the photos of Marcus's screen, documentation showing the original data from my trial, and notes detailing our confrontation. When Dr. Rivera arrived at 8:45 a.m., I knocked on her office door, my evidence folder clutched tightly in my trembling hands. She welcomed me in, noticing my strained expression. As I began explaining why I needed to speak with her, the door opened behind me, and Marcus entered without knocking. He insisted he should be part of any discussion involving our joint analysis work. Dr. Rivera expressed confusion, noting she wasn't aware of any collaborative project between us. Before Marcus could establish his narrative, I placed my phone on her desk, displaying the photos I'd taken. I explained discovering Marcus copying data from my rheumatoid arthritis trial and incorporating it into his quarterly reports, then his subsequent threat to use my fibromyalgia diagnosis to discredit me if I reported him. Marcus vehemently denied my account, claiming we had discussed methodology alignment weeks ago. He attempted to dismiss my concerns as a misunderstanding, nearly referencing my condition before I interrupted him. Dr. Rivera silenced us both with a raised hand. She examined the photos carefully, then turned to her computer and began typing. She questioned Marcus directly about accessing my trial data without authorization and creating documents that merged my results with his trial identifiers. The system logs confirmed every detail, including timestamps that corresponded exactly with my account. The color drained from Marcus's face as he realized the electronic audit trail had captured his actions. Dr. Rivera also noted that he had assured her Monday that his trial was showing consistent efficacy results, despite the email evidence suggesting otherwise. The office had grown unusually quiet, with researchers at nearby desks clearly aware that something significant was unfolding behind the glass walls of Dr. Rivera's office. Marcus changed tactics, lowering his voice confidentially as he reminded Dr. Rivera of his value to the research program and the importance of the main trial's success to company investors. He downplayed his actions as merely seeking structural consistency across related studies, insisting such practices were common in pharmaceutical research. Dr. Rivera's expression hardened visibly. She drew a clear distinction between legitimate data standardization through proper channels versus unauthorized access and manipulation of research data. She characterized his actions as not merely policy violations but potential research fraud with regulatory implications. She thanked me for bringing this to her attention, requested I document everything formally, and mentioned she would need to escalate the matter to the Ethics Committee, Regulatory Affairs, and possibly legal counsel. Marcus's professional demeanor collapsed entirely. He erupted, calling the situation absurd and explicitly referencing my questionable medical condition and need for special treatment as reasons to doubt my reliability. He suggested my perception was impaired by my alleged fibromyalgia. The silence that followed was absolute. Even Marcus seemed momentarily shocked by his outburst. Dr. Rivera stood slowly, her voice controlled but ice-cold as she instructed Marcus to report to HR immediately. She made it clear his discriminatory comments alone warranted disciplinary action, and combined with the evidence of data falsification, she had no alternative but to suspend him pending investigation. As Marcus stormed out, Dr. Chen appeared in the doorway, mentioning she had overheard our discussion. She volunteered that she had witnessed Marcus's threatening behavior toward me the previous evening, including his aggressive posture and raised voice. Dr. Rivera thanked her for coming forward and asked her to provide a formal statement. Turning back to me with a concerned expression, Dr. Rivera acknowledged Marcus's completely unacceptable and discriminatory comments about my medical condition. She assured me this would be addressed alongside the research misconduct allegations. The following days brought intense scrutiny of all Marcus's work. The Ethics Committee convened an emergency session, Regulatory Affairs conducted a comprehensive audit, and our legal department began assessing potential implications. Several other researchers came forward with concerns about Marcus's previous data presentations that they had questioned but never formally reported. The company's response was swift and comprehensive. 9 days after I discovered him falsifying data, Marcus was terminated for multiple violations, including research misconduct, unauthorized system access, data falsification, and creating a hostile work environment. But the repercussions extended beyond his dismissal. As the team thoroughly reviewed his trial documentation, we discovered numerous inconsistencies and manipulated efficacy outcomes throughout his reports. Our main trial hadn't been showing the positive results Marcus had repeatedly claimed in executive meetings. Dr. Rivera assigned me to the team responsible for revalidating all data from the main trial and developing honest communications for the FDA and our research participants. It was challenging and stressful work, especially explaining to participants and investigators that previous progress reports contained inaccuracies. But it also demonstrated our company's commitment to scientific integrity, even when it meant acknowledging setbacks. For months later, I was promoted to Senior Research Coordinator and given co-leadership of the restructured main trial. Dr. Rivera cited not only my technical abilities but my unwavering commitment to research ethics and patient safety as the primary reasons for my advancement. The day Marcus was escorted from the building by security was surreal. As he passed my desk, research credentials already confiscated and personal items in a box, he paused briefly. He muttered that he hoped I was satisfied, adding ominously that I had no idea what long-term damage I had done to the research program and potentially to patients waiting for treatment. I met his gaze steadily and replied that I knew precisely what I had done, protected research integrity and patient safety. He scoffed and continued toward the exit, posture rigid with indignation. I watched him leave, feeling not triumph but a complex mixture of vindication, lingering anxiety, and cautious optimism that our research department could recommit to the ethical standards that had drawn me to Medinova initially. The aftermath presented significant challenges. Our team worked extended hours to verify all data from the main trial, correct documentation, and rebuild relationships with research sites and principal investigators. I volunteered for substantial portions of this remediation work despite the physical toll on my condition, feeling personally responsible for ensuring no falsified data remained in our research ecosystem. I experienced occasional doubts during this period. During flare-ups, when pain and fatigue were at their worst, I sometimes questioned whether reporting Marcus had been worth the resulting turmoil. But then I would remember the potential consequences of allowing falsified efficacy data to influence treatment development for vulnerable patients, and my resolve would strengthen again. Remember, in medical research, integrity isn't a philosophical nicety, it's what ensures the treatments we develop actually help patients rather than merely advancing careers. And sometimes, protecting that integrity requires standing firm, even when it feels like you're standing alone. I never thought I'd be the kind of person who would seek revenge, let alone write about it online. But sometimes life puts you in situations where you either stand up for yourself or get walked all over. My name is Jordan, and until recently, I was a mechanical engineer at an automotive design firm in Detroit. I'm 35, generally easygoing, and I live with dyslexia, which has shaped how I approach my work and relationships. My journey into the world of petty revenge begins with my friendship with Emma. We met during orientation 4 years ago and quickly became friends. She was charismatic and ambitious, and we'd often collaborate on projects and go rock climbing with colleagues on weekends. I thought we had a solid friendship built on mutual respect. What I didn't realize was that Emma had a talent for using people. It started with small things, borrowing my design solutions without credit or forgetting to pay me back for lunches. My dyslexia sometimes makes it hard to notice subtle patterns in communication, so I missed the red flags. About a year ago, our company announced a major project developing a new fuel efficiency system for an electric hybrid model. The project lead would get recognition, a bonus, and likely a promotion. Both Emma and I were interested, but I had more experience with the specific technologies. Our manager, Mike, initially leaned toward choosing me. That's when Emma's behavior changed. She became even friendlier, constantly asking about my ideas and taking photos of my sketches. I shared everything. My innovative ideas for the thermal management system, a unique battery configuration approach, and solutions to weight distribution issues I'd identified. 2 days before the final decision, Emma requested an urgent meeting with executives. The next day, Mike told me Emma had presented her project proposal, identical to what I had shared with her. She had beaten me to the punch and was awarded the project lead position. When confronted, Emma claimed the ideas were collaborative, and that she had simply taken initiative. Mike kept her as lead, and I agreed to work under her because I still cared about the project's success. What followed was 6 months of Emma taking credit for my work and pushing me to the periphery. My dyslexia made navigating this political situation difficult. I would focus intensely on technical problems, creating detailed models and prototypes, only to discover Emma had presented my solutions as her own while I was buried in the design lab. The breaking point came during our annual company retreat at a lakeside resort in Michigan. I had been working on resolving a cooling system integration that kept overheating during high-load simulations. After 3 sleepless nights, I finally had a breakthrough. I identified an issue in the thermal management system and developed an elegant solution that would not only fix the overheating, but improve overall efficiency. I documented everything meticulously and planned to present it during the retreat. On the second day, we had a showcase session. I had signed up to present my solution, but as I set up, Emma approached me. "Hey, Jordan, there might be a misunderstanding. Mike asked me to handle the presentation for our team today." I looked at her in confusion. "That's strange. I specifically signed up to present the cooling system fix I've been working on." "Well, as project lead, I should be presenting our team's accomplishments. Besides, I've already prepared slides that include your contribution." Before I could respond, she took over the presentation area. When I approached Mike, he said, "Emma mentioned you weren't feeling well and might not be up for presenting. She said you'd had a tough night with your dyslexia acting up, and she'd cover for you." My heart sank as I watched Emma present her solution to the cooling system issue. It was my design, my approach, my innovation, but presented entirely as her own work. She didn't mention my name once. After identifying a fundamental flaw in the original approach, she said confidently, "I reworked the entire thermal management system from the ground up." When questions arose about implementation details, she fumbled, revealing her limited grasp of the engineering principles. The elegance of my solution, she continued, is that it not only fixes the immediate issue but improves system efficiency by approximately 17% under high-load conditions. 17%. The exact figure from my documentation. During lunch, I confronted her away from the group. You stole my work. Again. You didn't design a single component of that system. She rolled her eyes. Oh, grow up, Jordan. This is how the real world works. Ideas belong to the team, and as the lead, I represent our collective work. But you explicitly claimed you developed the solution yourself. Look, she said condescendingly, with your condition, you're better off focusing on technical details and leaving presentations to people who can handle the spotlight. I'm doing you a favor, really. Her mention of my dyslexia, something I had shared in confidence, hit me like a slap. She had weaponized it, casting it as a deficiency that made me less capable. As she walked away, she turned back with a smirk. By the way, I've recommended that we reassign you to the legacy vehicle maintenance team. Your talents are wasted on cutting-edge development work. That evening, while most of the team attended a bonfire social, I remained in my cabin. My roommate, Noah from the testing team, returned early and found me staring blankly at my laptop. You okay, Jordan? You've been quiet all day. Something broke inside me. Suddenly, I was telling him everything. The months of Emma taking credit for my work, the gaslighting, and now the threat of demotion. Noah listened without interrupting. I wish I could say I'm surprised. She did something similar to Priya last year, though not quite as blatant. And nobody called her out on it? Priya left rather than fight it. Emma's good at building relationships with the right people. She has Mike wrapped around her finger. So there's nothing I can do? I didn't say that, Noah replied thoughtfully. You must have evidence of your work. Timestamps, design iterations, documentation drafts. A spark of realization hit me. I did have evidence, lots of it. I maintained meticulous records to manage my dyslexia. I had design files with timestamps, saved documentation drafts, emails discussing my approach to the problem, and chat logs where Emma had asked me to explain concepts she later claimed to have developed. I have everything, I said slowly. But who would believe me over her? Maybe not Mike, Noah admitted. But Olivia in legal is a straight shooter, and she takes intellectual property very seriously. The next morning, I scheduled a meeting with Olivia back at the main office. I spent the rest of the retreat carefully compiling my evidence. When we returned to Detroit, I met with Olivia and laid out everything. I showed her my original design files predating Emma's solution, chat logs where she asked me basic questions about concepts she later claimed to have developed, and emails where I outlined my approach followed by slides from her presentation using identical language. Olivia listened attentively. This is a serious situation, Jordan. What you're describing could constitute intellectual property theft and fraud, especially considering the financial implications. I don't want to cause trouble, I said, suddenly unsure. I just want recognition for my work. Theft of intellectual property is already trouble, Olivia replied firmly. Let me review everything and consider the appropriate next steps. 2 weeks later came the quarterly review meeting. As usual, Emma dominated the conversation, highlighting her innovations. Just as she was describing how her cooling system solution had saved the company significant resources, the door opened, and Olivia entered with our CEO, Robert Chin. I apologize for interrupting, Robert said, but I need to address an urgent matter regarding attribution of work and innovations. The room fell silent. Emma's face remained composed, but I noticed her knuckles whitening as she gripped her pen. Integrity and honesty are core values of this company, Robert continued. Olivia has brought me evidence suggesting that significant contributions to this project have been misattributed. For the next 20 minutes, Olivia methodically outlined the evidence I had provided. She showed side-by-side comparisons of my original documentation and Emma's presentations, highlighted timestamps proving I had developed the solutions before she claimed them, and included testimony from team members who had witnessed her taking credit for my work. Emma's face cycled through expressions of disbelief, anger, and finally panic as the evidence mounted. Emma, these allegations are extremely serious, Robert said gravely. Before we proceed, do you have anything to say in your defense? Emma's facade crumbled. It's not how it looks. Jordan and I were collaborating. I may have misremembered who originated certain concepts. The documentation is quite clear, Olivia replied coolly. Design files, email timestamps, and witness statements all contradict your version of events. Robert nodded. Emma, Please collect your personal belongings and accompany Olivia to HR. Your access to company systems has already been revoked. As Emma was escorted out, Robert turned to me. Jordan, I owe you an apology on behalf of the company. I'd like to meet with you privately to discuss proper attribution for your work and your role going forward. Later that day, I learned the full impact of my actions. Emma had been terminated and was required to return the substantial project bonus she had received for her innovations. The company was even considering legal action to recover damages related to a patent application she had filed using my work. Moreover, they offered me the project lead position, along with a compensation adjustment that included back pay and the bonus that should have been mine. The total came to just over $30,000, money that would have gone to Emma if I hadn't stood up for myself. The following week was a whirlwind of changes. I was officially announced as the new project lead, with a company-wide email from Robert that specifically highlighted my contributions. My team members were supportive, many admitting they had suspected something wasn't right but hadn't felt comfortable speaking up. Mike kept his distance, clearly embarrassed by his failure to recognize what had been happening. He was placed on administrative probation and required to complete management ethics training. As for Emma, I heard she had tried to secure a position at a competing firm, only to be rejected when they contacted our company for a reference. The legal implications of her actions had necessitated transparent communication with potential employers. The project continued successfully under my leadership, with the cooling system receiving particular praise when implemented. 6 months later, we were awarded a patent for the design, with my name listed as the sole inventor.